Thank you very much, colleagues. And I am so very pleased to be here today with you in this webinar and to present the second edition of the Accelerated Action for the Health of Adolescents, AHA guidance. And you will be the first country to have this national orientation of the guidance, because the guidance actually was launched on October 11th. So it is slightly more than 2 weeks ago. And I am pleased to have this opportunity today to present the key messages from the AHA guidance. I will ask colleagues to put up the slides, and then we can proceed. So what is the AHA guidance? Next slide, please. Not the AHA guidance, but what is AHA, Accelerated Action for the Health of Adolescents? Next slide, please. It is more than a guidance. It's not only a document. It is also an initiative by UN agencies to unite under a common agenda for a comprehensive approach to adolescent health and well-being. It is also a guidance that aims to assist governments in identifying national and subnational priorities and implementation strategies as they respond to the needs of adolescents. Now, why the second edition? A bit of a history. The first edition was published in 2017, building on the momentum created by the 2030 Agenda for Sustainable Development and the United Nations Secretary General Global Strategy for Women, Children, and Adolescent Health. Some of you may remember that this was a follow-up strategy of the previous UN Secretary General Strategy for Women and Children Health, and adolescents were nowhere in that first strategy. Now, the historical value of the second strategy was that for the first time, adolescent health was put high in the UN agenda. And member states of WHO requested WHO to follow up with an implementation guidance. So us producing the AHA guidance in 2017 was answering a request from member states. And on October 11, we launched the second edition. The second edition incorporates new evidence, new areas and experiences, lessons learned from the experiences gathered since the first edition was published. Next slide, please. So what is new in the second edition? Obviously, between 2017 and 2023, that's 6 years. 6 years during which a lot of new things have happened. First, the second edition has new data on mortality, morbidity, selected health outcomes, risks and protective factors, and determinants of health. As well as in the second edition, we updated the interventions that work for adolescents, because in the 6 years since the first edition, new guidelines were published, new studies became available. So we wanted to make this AHA guidance up to date to incorporate the latest knowledge. But also, a lot of political and scientific advances happened since 2017, and we wanted that the guidance reflects this. The first edition of the AHA guidance was very popular with countries, and many countries, I will show you in one of the next slides, applied the AHA guidance to inform their own national strategies and plans. And we learned a lot through this process. Therefore, we wanted to integrate those learnings into the second edition of the AHA guidance. Also, WHO, the Partnership for Maternal, Newborn, Child and Adolescent Health, and other UN agencies such as UNFPA, UNICEF, and others came together to define what adolescent well-being means. Because we very often say health and well-being, adolescent health and well-being, but what exactly this well-being part means and how do we measure it. We never had a very clear definition. We never had a very clear framework then that will enable us to measure adolescent well-being. So UN agencies came together to have a definition of the well-being and to define the domains of adolescent well-being. I will show you later in the slide. So this again needed to be integrated into the second edition of the AHA guidance. And finally, we went through a major pandemic, the COVID-19, and there were a lot of lessons to be learned from this pandemic, how we deal with a public health response, how it affects different population groups, adolescents included, and we wanted to integrate those lessons in the second edition of the AHA guidance. Next slide, please. Now, I said that the AHA is more than a document. It is an initiative of UN agencies that unite together under a comprehensive agenda for adolescent health. So why we think that this comprehensive approach is so important? We know that in past, adolescent health was mostly associated with adolescent sexual and reproductive health. Whereas attention to other major issues, such as violence in injuries, non-communicable diseases, mental health, were less addressed. And since 2017, many highlights were in the global reports and in the global guidance that actually made the point how very important that we have a comprehensive and integrated approach to adolescent health, starting with the need of the individual, not with the disease. We made this case in the first edition. Then we had the Political Declaration on Universal Health Coverage in 2019, which states that universal means universal also in terms of the access to services, but also in terms of a comprehensive package of services. Then a couple of other reports that I mentioned in this slide, such as, for example, the WHO UNICEF Lancet Commission report pointed that to address the modern days challenges of children and adolescents, we need to look across sectors. We need to look at the protection from aggressive marketing. We need to look at the prevention of non-communicable diseases. We need to look at violence prevention. We need to look at the sexual reproductive health. And that means a comprehensive package. Also, we came together with UN agencies. In 2021, we published a new guidance package to make every school a health promoting school and to promote health and well-being agenda within the education sector. And then the Lancet Commission on Optimizing Child and Adolescent Health and Development also called for a comprehensive package, a comprehensive approach to adolescent health. And hence the 2023 second edition advances further these arguments in favor of a comprehensive package for adolescent health and well-being. Next slide, please. Now, I said that the first edition of the AHA guidance was instrumental in accelerating actions in countries for adolescent health and well-being. And on the left-hand side of this slide, you see some examples. For example, by the end of 2022, most of the countries in the African regions, in the American region and Southeast Asian region, and selected countries in the Eastern Mediterranean region and Western Pacific had used the AHA guidance to inform their national plans. Not only the guidance influenced national plans, but also it was an influential framework for informing regional initiatives and political commitments. For example, the African region launched in 2017 the Adolescent Health Flagship Program for Africa. The Plan of Actions for Women, Children, and Adolescent Health 2018-2030 of the Pan American Health Organization was also influenced by the AHA guidance in its adolescent health part. The regional framework of joint strategic actions for young people in the Eastern Mediterranean regions also followed the publication of the AHA guidance, and the European region made their own regional adaptation of the AHA. So what have we learned from this wide application in countries of the AHA guidance? We learned that the AHA systematic approach, I will present in next slides what do we mean by the AHA systematic approach. So this approach to plan programs for adolescent health and well-being is suitable for countries with different epidemiological profiles. We also saw that the menu of intervention and implementation strategies that are listed in the AHA guidance is a good menu for countries to choose from. And it is a good approach rather than presenting some sort of a global core package of interventions and strategies for all countries. So the menu gives the opportunity for the countries to choose what is relevant for their specific context. We also learned that the AHA systematic approach, whereas the main purpose was to inform the national planning, but it is also suitable for district level planning, for subnational level planning. There are countries where the healthcare and health system is very decentralized and budgetary decisions are made at the subnational level. And we saw in countries such as Nigeria, DRC, that it worked well for district level planning as well. And importantly, we saw that the AHA planning, the application of the AHA planning results in increased youth participation in developing national strategies and plans and facilitates multi-sectoral approach. Next slide, please. I said that the AHA is more than a document, that it is one UN approach to a comprehensive adolescent health agenda. And in the second edition, we strengthened even more this approach in the foreword that was signed by our Director General that supports the investment in adolescent health and well-being, but it was also signed by heads and executive directors of other UN agencies. So again, why I am emphasizing this, because it is important that the way we work jointly at the global level to produce this guidance and other guidance, such as making every school a health promoting school, it is important then when the strategic planning for adolescent health and well-being is made at the country level, that UN country team also works together. Next slide, please. So what is the AHA systematic approach to accelerate action for the health and well-being of adolescents? It is presented here in one slide. And in the following, we will go through each section. So actually, the systematic approach is reflected in the sequence of chapters in the AHA guidance. So chapter 1 is about building an investment case. This chapter provides key argument about what is special about adolescents and why investing in them results in long-term societal benefits. This would also be the first step in a country. A country that wants to develop an investment plan for adolescent health and well-being would need to make an argument why you need a plan for adolescent health and well-being. So you will have to build your arguments to convince your government, to convince your Ministry of Finance. So that's the first step in the process. Then the chapter 2 describes what would be a second step in the process, which is understanding the status of adolescent health and well-being. In the AHA guidance, it is the worldwide status. For a country, it will be the step to understand the status of adolescent health and well-being in your country. This chapter helps to understand the main causes of ill health in adolescents globally and regionally, and the determinants of health and well-being. Again, in a country, you will have to produce statistics for the main causes of ill health in adolescents in your country to have this understanding of the status. Then the third step in the process in this systematic AHA approach is identifying evidence-based interventions for adolescent health and well-being. And this is described in chapter 3. This chapter provides a menu of evidence-based interventions across 7 areas of adolescent health: unintentional injuries, violence prevention, sexual and reproductive health and HIV, communicable diseases, non-communicable diseases, nutrition and physical activity, mental health, substance use and self-harm, and interventions in humanitarian and fragile settings and across well-being domains. Now, in a country, you will have, after you analyze the problem, which is the second step, then you will have to answer the question, okay, but what works to address those problems? Now, because in the chapter 3, we made sure that latest evidence-based interventions for every area of concern are there, you do not need to do this scientific work of synthesizing the available evidence, because we did it already. So you can use chapter 3 to inform your actions. Then the next step in the systematic process would be, okay, given the spectrum of the problem, what would be our priority for, say, next 5 years? Because you will have to make choices. You cannot address everything at once. You will have to set your national priorities for adolescent health and well-being programs. Granted, those priorities will have to be revisited every now and then because the situation changes. You manage to address some issues, new issues appear. So this is a continuous process. But for, say, a term of the next 5 years, you have to be clear where your focus will be. And this is described in chapter 4. How do you go about identifying your national priorities? Chapter 5 is then helping countries to conceptualize and implement national adolescent health and well-being programs. After you have undertaken step 4, which is setting national priorities, you will have a list of priorities. For example, you will say that for us, it is very important for the next 5 years to focus on preventing substance abuse or preventing adolescent pregnancy or a couple of other priorities. But then you have to translate those priorities into the actions and plans. And this is what we call programming. Programming for adolescent well-being describes pathways for programming and approaches to multi-sectoral actions, as well as key implementation strategies for health sector, as well as for 9 other sectors. I will present this because we will go in the following chapter by chapter. Again, this chapter presents a menu of possible implementation strategies, and the country can choose what is more appropriate given your context, given your situation and past experience. And finally, chapter 6 describes what would be the next step in your systematic approach, which is after you have your priorities and after you have your key implementation strategies and actions, how do you measure success? What would be the indicators that you want to measure regularly? How can you strengthen your data collection methods and strengthen management information systems in health, but also in other sectors, to produce reliable statistics that can inform your decision making as you go forward. And across the 6 chapters, principles of meaningful youth engagement and participation, as well as addressing the needs of the vulnerable population with a special focus on humanitarian and fragile setting, is being kept. Next slide, please. And now we will go a little bit more in details chapter by chapter, but I want to say that it is not my intention today, and it is not possible given the time limitation, that you know everything about the content of the chapter. My intention here is to give you, so you leave this webinar with a clear knowledge what type of information is there in every chapter, how it can help you, but you will have to do your homework to actually go to the document and see what it has to offer. So chapter 1 is advancing the case for investment in adolescent health and well-being. It has 4 sections. Section 1 summarizes the scientific, political, and programmatic advances in adolescent health and well-being since 2017. Then the next section of the chapter makes the case why to invest in adolescent health and well-being. It presents data on economic benefits, on public health benefits, on societal benefits. Then section 3 explains what is special about adolescence. And this is explained through determinants at individual level, what is special at this level, and then what is special at interpersonal and community levels, and how determinants at organizational, environmental, and structural level play in a very particular way during adolescence. Then section 4 summarizes the lessons learned from the pandemic. It also lists other current threats for adolescent well-being and what are the opportunities for us to advance the agenda on adolescent health and well-being. It shares lessons learned from COVID-19 pandemic as they pertain to adolescents. It highlights the importance of addressing climate change, a special case and special vulnerabilities for adolescents in settings of armed conflict and displacement. And it concludes with opportunities that are for us today. Next slide, please. So what is new in this chapter as compared to the previous edition? It has this summary of lessons learned from the first edition. It summarizes the key findings and political programmatic advances since 2017. It presents the adolescent well-being framework. It makes the investment case up to date with new statistics and new economic estimates. And it summarizes the lessons learned from COVID-19 pandemic. Next slide, please. So what are the key messages of this chapter? So you will have to click to go one by one for the messages. So the one is that adolescence is unique and requires special attention in policies and strategies. The global consensus of adolescent well-being sets the agenda for a new generation of adolescent programs. Investments in adolescent well-being bring a triple dividend of health and economic benefits. The 2030 Agenda for Sustainable Development cannot be achieved without investment in adolescent health and well-being. And the COVID-19 pandemic has brought into the spotlight the role of school health to ensure critical nutrition, social protection, mental health, and other services. Next slide, please. So how can you use this chapter? next, please to click. You can develop context-specific advocacy material. So you can use this content, for example, to produce a policy brief on why to invest in adolescent health. You can make a case for comprehensive adolescent health and well-being strategies. You can use it to inform your applications for donor funding, for financial departments. You can make a case for investing in adolescent health research, and you have a useful checklist of all spectrum of determinants of adolescent health. So for each chapter, I have prepared this, what are some of the possible usage of the content to give you a sense of the practical application of the AHA guidance. But in the following, I will just summarize them for each chapter. I will not go in very details. Next slide, please. So chapter, now I said that UN came together with a consensus of adolescent well-being. And here are the domains of adolescent well-being. What do we mean by well-being? It has 5 domains. The well-being is composed by having good health and optimum nutrition, having good connectedness, positive values, and contribution to society, benefiting from safety and supportive environment, having access to learning, competence, education, skills, and employability, and having a sense of agency and resilience. So it is important to understand that well-being means all those things, because an adolescent who is, say, in perfect physical health is not necessarily well, because if the person doesn't have the sense of agency or resilience, or feels lonely because doesn't have the connectedness, or doesn't have access to good education, which diminishes his or her employment prospect, all this diminishes the well-being. So it's not only about the physical health, it is about all those domains. Therefore, we say that the second edition of the AHA makes the case for a new generation of adolescent health and well-being programs that consider in their planning and interventions all 5 domains. Next slide, please. So chapter 2 presents the status of adolescent health and well-being. It gives an overview of mortality and morbidity, of risk and protective factors, and selected outcomes and determinants for adolescent health and well-being for the 10 areas that are listed here. I listed them before when I did the introduction to the systematic approach, so I will not repeat, but you see them on the slide, starting with unintentional injuries all the way to the nutrition. And then it also presents the statistics, what are the key vulnerabilities for adolescents in humanitarian and fragile settings. What is new in this chapter? All these statistics was updated because the, next slide, please. In the first edition, the estimates were based in those 15 estimates. In this second edition, the estimates are updated with 19 estimates. Next slide, please. So the key messages of this chapter are the following. One is that adolescents constitute a large proportion of the global population, 16%. And whereas over the 20 years, the last 20 years, mortality rates from all causes have declined, but the morbidity stagnated. We know that the most important risk factors for mortality and morbidity across all regions and age groups are iron deficiency, unsafe water source, low birth weight and short gestation, and unsafe sanitation. And evidence is growing on the role of protective factors at individual, family, and societal level on adolescent health and well-being. How can you use this chapter? One, you can use the global and regional estimates to have a sense of, next slide, please, to have a sense of what type of data you have to analyze when you want to understand the situation of adolescent health and well-being in your country. If for some areas you do not have national statistics, next slide, please, then you can extrapolate from regional estimates, although this is not the ideal, but you can use the estimates or national estimates, because WHO produces estimates also for countries, and you can use these statistics. And it has a checklist of all spectrum of health areas relevant to adolescent health. So it's a useful reminder what type of data you should collect when you analyze your national situation. Next slide, please. So chapter 3 is this menu of evidence-based interventions. It answers the question, what works for all areas? Again, all those areas are the same, starting with positive health and development interventions, and then unintentional injuries, violence prevention, sexual and reproductive health. So if you want to know what works, for example, to prevent non-communicable diseases, this is a large area in itself, because we are talking about many diseases and many risk factors. You go to this section and you will have the list. I will give you some examples now. Again, next slide, please. What is new in this chapter? All those evidences were updated with data from research and research results that were published since 2017. Next slide, please. What are the key messages of this chapter? Well, the key messages is, first, we know what works. But there are some gaps, of course, which should not preclude us from taking actions. And those gaps are related to what works in humanitarian crisis, the gender transformative programs, and digital interventions. We have to learn more how to deploy and plan digital interventions so they increase adolescents' access to services and interventions without producing new risks. And we also, one of the key messages of this chapter is that given the multidimensionality of adolescent health and well-being, collaboration across sectors through multi-sectoral or integrated programming is crucial, because when you will look at those interventions, many of them are outside of the remit of the health sector. For example, one of the major killers of adolescents globally is road traffic injuries. But the solution is not with the health sector. Most of the solutions, when you look at the list of interventions, is for other sectors. So this multi-sectoral approach to addressing problems is very important. How you can use the content of this chapter, next slide, please, as a menu of interventions from which you can choose. Here is an example of interventions to prevent and mitigate road traffic injuries among adolescents. And you can see that interventions are classified by level, starting with the individual level. What can you do at the individual level with the adolescents, like helmet distribution, and then community level interventions and structural and environmental interventions. Next slide, please. So the next example is from sexual and reproductive health, including HIV. Again, you have the interventions at the various levels. For example, organizational level to provide contraceptive counseling and services, provide comprehensive sexuality education, peer education programs, and then structural and environmental interventions, which is policies and funded implementation plans. And then the further details of the interventions, as well as the original source that recommends this intervention, are provided. Next slide, please. So what are some of the possible usages of the contents of the chapter 3? Next slide is a checklist of interventions during landscape analysis. And then you can inform either a proposal for donor funding or your comprehensive adolescent health strategies and plan, or make the case for investing in research to address knowledge gaps. Next slide, please. Chapter 4 is a chapter that explains the process of setting national priorities. There is so much that you can do in adolescent health and well-being. So how do you choose? How do you make those hard choices? This is explained through the process that has 3 steps: needs assessment, landscape analysis, and setting priorities. Next slide, please. What is new in this chapter as compared to the first version is that the process of national prioritization is explained through the lenses of all domains of well-being. In the first edition, we mainly used examples from health domain, but now we are using examples from all domains of well-being. It also has a sharper focus than before on gender analysis during needs assessment and landscape analysis. And it talks about priority setting not only at the national level, but also at subnational and local levels. And it has new case studies. Next slide, please. So the key messages of this chapter, that the process of national prioritizations should be based on solid situation analysis. It should be explicit, transparent, and involve all relevant stakeholders across key sectors and departments within the health sector. Over time, countries should reassess their priorities, because priorities do change. And if you don't have this continuous learning and reassessing, then your plan will be obsolete. And while national and subnational priorities guide local action, further contextualization of program activities should take place locally. How can you use this chapter in your work? You use it as a guide. Next slide, please. How to organize this process in your country, how to organize the needs assessment, how to organize landscape analysis, and how to prioritize. And it is a checklist of the type of data sources that is required at each of those 3 stages. Next slide, please. So finally, chapter 4 and 6. Chapter 4 is about programming, which is translating priorities into plans and actions. It has 3 sections. Section 1 presents the logical framework for translating priorities into plans and programs. Then section 2 talks about how to plan multi-sectoral action. And section 3 provides a menu of key implementation strategies in 10 sectors: in health, education, social protection, criminal justice, labor, telecommunications, roads and transportation, housing, urban and industrial parks planning, energy and environment. What is new in this chapter is that the logical framework was updated to incorporate all domains of well-being. There is a better description of the complementarity of different approaches for programming. There is new evidence from the global analysis of school health programs, and the key implementation strategies in those 10 sectors were updated based on the latest guidance. What are the key messages of this chapter? Next slide. Before the key messages, here is the logical framework. And this is a matrix that will help you design the key elements of your program. On the bottom, it starts with the program components, and then it explains for each of those program components, what are the required inputs and processes, what would be the outputs, the outcomes, which would be the domains of the well-being, and the impact, which is the program goal, will be the improvements in health and well-being of adolescents. So again, this is, we believe, a very useful matrix. We did apply, we saw how it helped countries to plan the hierarchy and the logic between different elements in your plan. And we encourage you to use it when you design or update your national plan. Next slide, please. So the key here again, the key I want to show you this because not only we provide a list of key implementation strategies, but each of those subsections for each sector ends with this resource bank for adolescents. And here is the example for adolescents in housing, urban planning, and industrial parks planning. Those are the guidance across UN, because many other UN agencies deal with urban health, with housing, and labor issues, for example. So you can quickly scan the QR code. Of course, all those material are also in the reference list of the AHA, but we thought that it might be more user-friendly way of directing you immediately to the key guidance for each of those two sectors. Next slide, please. So the key messages of chapter 5 are that the most powerful gains for adolescent well-being result from multi-sectoral action. The evidence is clear that the smartest investments are coordinated investments in health and education. Adolescent responsive health systems are key to achieve universal health coverage. Countries should ensure that adolescent expectations and perspectives are heard in national programming processes. Also, we have to acknowledge that when we talk about adolescents, we are talking about a very diverse group with diverse needs, and leave no one behind should be a key principle in programming. And to ensure sustainability, responsibility for funding programs for adolescent health and well-being should be shifted towards domestic resources by including a focus on adolescents in national sectoral strategies, investment plans, and budgets. Next slide, please. Some of the possible usages of the content of chapter 5 is to inform the logical framework of a national strategy, to inform an implementation plan. The list of key implementation strategies for 10 sectors will help you to plan your activities when you have your implementation plan for the strategies. It will help you to make the case for an informed multi-sectoral action and to inform, for example, an application for funding. But for the point on multi-sectoral action, it is very important that when you talk, for example, if the majority in this webinar are people from the health sector, then you are the advocate for adolescent health and well-being with other sectors. And when you talk with your colleagues in telecommunications, for example, you should be able to know exactly what you want to ask them to do. So it's not just saying you should do more for adolescent health, but what exactly? And what exactly is in chapter 5? Next slide, please. And finally, chapter 6 is about monitoring, evaluation, and research. It has 7 sections. One is provide a global overview of indicators, the core indicators that are proposed by the Global Action for Measurement for Adolescent Health, the GAMA group. Then it explains the data collection systems for adolescent health and well-being indicators. It presents an overview of the global adolescent health databases, the importance of disaggregating data to monitor inequality, explains the principles of country-level monitoring and evaluation of programs. It talks about how to advance research for adolescent health and well-being. And finally, how to uphold the principle of adolescent participation in monitoring, evaluation, and research. Next slide, please. What is new in this chapter is that it presents the core set of priority indicators for adolescent health that are recommended by the GAMA advisory group. It presents a measurement approach for adolescent health and well-being, which is under development. We came up with the well-being domains, the 5 domains, but now we have to make the next step, how to measure well-being. What will be the indicators, for example, to measure connectedness? Or what would be the indicator, how you can measure agency or resilience? So we are now doing this work to come up with indicators for other domains of the well-being. And then this chapter also has good practices and key principles for the meaningful inclusion of adolescents in monitoring, evaluation, and research. Next slide, please. So the key messages is that the gamma list of indicators provide a useful list for you to focus your measurement on the key core group on indicators, that as we go forward, we should develop an approach and be able to measure progress towards well-being, not only health. That is essential to disaggregate data to be able to measure inequalities. It is important also to monitor programs based on a full range of indicators, from inputs indicators, process indicators, outputs, outcome, and impacts, because those indicators at different levels have a different role in monitoring programs. As to the research, we know what are the priorities for adolescent health research, but this priority setting exercise needs further updating to see what are the priority areas that require particular attention. And importantly, when you monitor and evaluate your program, you should ask adolescents what they think about it. So an evaluation of a program is not complete and is not valid if adolescents' voices are not being heard. Next slide, please. Again, it has very practical applications, how you can use this chapter. You can identify what are the key data gaps in your national management information systems, not only for health, but also for other sectors. You can inform your national indicators and targets. You can develop an M&E framework for national strategy and plan. And you can inform a research for proposal or have a focus on implementation research in your country, and inform those efforts by looking at the contents of chapter 6. Next slide, please. So now I went through the AHA systematic approach. So the 6 chapters mirror the step of a country process, starting with making a case for investment all the way up to the monitoring, evaluating your program. But the AHA is also a useful resource because we not only we say what should be done, but we also show through a multitude of case studies that it has been done somewhere. And we hope that those case studies will be inspirational for other countries. Next slide, please. Finally, that's my last slide. Those are the key messages of the AHA summarized in one word. AHA says awesome. A stands from adolescents are not simply all children and young adults. They need special attention. W, well-being is more than the absence of disease, and we need a new generation of well-being, adolescent health and well-being programs. E, from effective solutions exist, we know what works. This is in chapter 3. S, from sectors and stewardship, multi-sectoral action is required, and it requires strong leadership across government. O, from ownership by adolescents, for adolescents, of decisions affecting their lives is the right. M, from multiplier effect, investing in adolescent health brings triple dividend across the life course and across generations. And E, equity means every adolescent counts. Thank you for your attention and very happy to answer questions. Back to you, colleagues in Myanmar.